Good morning, Queensland. I can advise that we've had 0 new cases today, which is fantastic news. So well done, Queenslanders, for all doing the right thing and making sure that you're socially distancing, good hygiene, wearing the mask where required, and of course coming out and getting tested. We're now at 13 active cases. And we have had 5,879 tests in the last 24 hours. So we would like to see those testing numbers come up again, particularly in areas like Gundawindi, also in Cairns and Cardwell and Atherton, where we know that the individual who went to the Northern Territory has been. We had 10,626 vaccinations by Queensland Health over the last 24 hours. And the great news, over the 25 Bunnings locations on the weekend, we had 5,502 doses administered. And the really exciting news of that is over 50% were first doses. So we are seeing more and more people still coming out to get that first dose, as well as getting their second dose. Now, I remind people, if you are due for your second dose, don't wait. The sooner you get your second dose when you are eligible, the sooner you'll get that broader protection. So please, if you are due for your second dose, whether it's Moderna or Pfizer or AstraZeneca, please come forward and make sure you're getting that dose. Our busiest site of Bunnings was North Lakes, so well done North Lakes, with 645 vaccinations over the weekend. That now puts us at 79.49% first doses and 67.14% fully vaccinated. So the numbers are getting up there, but we want to see those numbers creeping up even quicker, and that is really up to you, Queensland. Make sure you're coming out and getting vaccinated. If you're vaccinated, but you know, family, friends, work colleagues, neighbours aren't yet, have a conversation with them, encourage them to come out and get vaccinated. 2 announcements I'd like to make in relation to Katherine in the Northern Territory. We will be lifting the hotspot declaration on Katherine from 4 p.m. this afternoon due to changes in the declaration by the Commonwealth and the Northern Territory. And also because a close contact has been to the Toowoomba Hospital, we are limiting the restrictions of visitors to the hospital. Of course, still allow for end-of-life visits and palliative care. So you can work that through with the local hospital if you do need to visit for that reason. Otherwise, we are asking people not to visit the Toowoomba Hospital at the moment. So we are making sure that people are not at risk. And I'll ask Dr. Aitken to just comment a bit more. Thank you.
Thank you, Minister. And just to repeat again, really good news. No new cases, particularly no locally acquired cases in Queensland today. I had hoped to be standing here today saying we'd reached 80% single-dose vaccination. Not quite there, but oh so close. But on the vaccination perspective, there's some really good figures in Cairns and over the weekend. And 119 out of the 198 vaccination doses at the Cairns Convention Centre were first doses, which is absolutely brilliant. And the Bunnings at Atherton, 26 out of the 33 doses were first doses as well. So really wonderful. And the more people we have coming forward getting those first doses, the better it is for Queensland as a whole. A couple of things just to make comment on. Toowoomba, as the Minister's mentioned, this is a close contact, visited a relative in the Toowoomba Hospital. That person has tested negative and very happy with that news. But as an abundance of caution, we're just making sure at the current stage that we are restricting visitor numbers to make sure that community, in particular the most vulnerable members of our community, those people in hospital, are safe at this stage. The other thing of note is in Cairns, despite all that testing, there's been no cases in Cairns, which is really good news as well. And Katherine, the Northern Territory Government has removed the lockdown from the Katherine community with no more cases there, and the Commonwealth is moving to lift the hotspot declaration, and similarly we'll mirror that and lift the hotspot declaration at 4 o'clock this afternoon. Overall, same message. If you've got symptoms, come out and get tested. If you haven't been vaccinated yet, please come forward and get vaccinated. We're getting closer and closer, and the more people do get vaccinated, the more we can start to look at our lives coming back to a bit more normality, as some people have referred it to. So thank you. Please get vaccinated.
When will you be able to tell us rules around vaccinated staff and patrons and what happens in that scenario? In those scenarios?
Sorry, with the hospital or?
No, around businesses, for example, what happens if they only allow vaccinated people inside?
Sure. So we're still working with businesses. There's a task force, a business group that has been set up since the start of pandemic that we've been working with industry over the months. We'll continue to consult with them about what directive, if any, should be put in place in these areas. So we'll continue to work with them. We will say this though, the comments about the economy, we have really led the way when it comes to our recovery out of COVID because of the measures that we have taken and the very low levels of cases that we've had and the very few lockdowns that we've had. So when you look at our most recent data, the latest ABS labour force shows our unemployment rate at 4.9%, which is at the lowest level in more than a decade. We've had more than 100,000 more Queenslanders in work now than in March 2020. Retail sales are also 16% higher than they were pre-COVID. And across the state, we have the lowest level of bankruptcies ever recorded. So I think, the business sector and the retail sector can be very optimistic when it comes to looking towards Christmas, because what we do know is once we hit our 70 and 80%, there'll be a lot more people who will be able to come into the state. And that means a lot more visitors and a lot more spending money. So I suspect that, it will be, only positive news going forward. But we do have to be mindful that we need to keep getting vaccinated, because if we want to ensure that our economy stays open and that we do have everyone being able to fully function and have a great lifestyle and be out spending money and at the shops and in businesses, then we need to make sure we've got the highest level of vaccination that we possibly can.
Can you appreciate though why there is some confusion or inability to plan forward? They're not sure under what circumstances they might be closed, how to plan for workforce when they don't know what the rules are, when they don't know whether if a patron comes in and they have COVID, whether they'll have to close for 2 weeks, or if a staff member has COVID, whether the entire company will go into his quarantine. Like that, they're the questions they need answers for.
Well, the fact is I don't believe there's any jurisdiction in the country that has that sort of detail that says if there's an outbreak in this business, this is what we'll do. That will be consistent with every single business across the country. So we don't see those sorts of rules clearly laid out in other jurisdictions either. Other jurisdictions are still putting restrictions in place depending on the outbreak and the amount of transmission in the community and so forth. So we don't see that sort of level of detail. We've never gone to the point of being absolute about this restriction will happen every single case because we know it will all be different. We know that there's different circumstances. It might be that the person who's got the virus is fully vaccinated, that there's no community transmission happening. That's different to multiple cases of unvaccinated people. So we'll continue to work with business. There's been a lot of consultation with business, a lot of consultation with the retail sector, the hospitality, tourism sector. We'll continue to work with them to provide as much clarity as we can. But what we know about this virus is you can only provide so much clarity. But what we can say is we have a clear plan. If businesses are wanting to know what's going to happen in Queensland, we have a very clear plan that from 70% double dose, that people will be able to come from interstate, including Victoria and New South Wales and the ACT, and be able to home quarantine if they're eligible, which is going to be, I suspect, the majority of people. And then come 80%, people will be able to come into this state by air or by road. They will not need to quarantine if they're fully vaccinated and they've got a negative test. Now, that's huge. So business should be extremely optimistic, knowing that when we hit the 80% mark, that we are going to have a lot more people moving to and travelling into Queensland. And that means that there's more money around the economy and more people out spending money and supporting businesses. So the roadmap's very clear on that. We've got a plan to reunite families, and that will also see us supporting the economy.
Well, why not put a date on 90% like you did for 80 and sort of give that certainty and say, well, we'll open at 90 or when we hit this date? I mean, business seems to be receptive to that one. I'm taking
Again, I don't think other jurisdictions have been able to say we expect to hit 90% on that date, because what we do know is once you get past the 80% mark, it becomes harder with that last few percent to get people coming out and getting vaccinated. We know that there's more hesitancy in that later group, so it's very hard to be definitive and say we know for sure that 90% will be hit within this time frame. But what that also means is that time frame is very fluid. Queenslanders could hit that 90% rate very quickly if they come out and get vaccinated. And we call on businesses, we call on the tourism sector, the retail sector, we call on everyone to do their part to encourage people to get vaccinated, because this is what will get us where they want us to be. We can hit that 90% mark, but we need everyone pulling in the same direction, which includes the opposition. Instead of travelling around the state constantly criticising the vaccine rollout, every single person should be pulling in the same direction. That is, calling on people to get vaccinated, dealing with this misinformation and the myths, breaking those myths down and making sure that people understand this vaccine is safe, it will keep you and your community, your family safe, and it's important that you get covered now.
Will the Queensland check-in app be modified to reflect vaccine status?
So we're working on that at the moment, and the platform we used was designed out of the ACT. We're working on what modifications can be made so that the vaccination status could also be read at the same time.
And just with the as you go before, does that mean that if a person comes into work and turns out they have COVID, they won't necessarily be closed down if that person is vaccinated?
Again, we will take health advice. Right now the health advice is that you're still looking at close contacts, and we've seen in the most recent cases we didn't shut down the whole school, even though there was close contacts in the school. So it will depend on the circumstances, it will depend on the rate of vaccination in those towns. When we have really high vaccination rates like under Windy, we know that we don't necessarily have to go into a lockdown. So we will take the health advice, and as we get closer to those higher percentages, and we'll be able to see what's happening interstate as well. I understand that the ACT are seeing large outbreaks in their schools right now. So we want to look at what's happening interstate to learn from what is happening there as to whether we still need to be putting everyone who's a close contact into quarantine. But of course we'll take the health advice as to deeming who is a close contact, and that may depend on their vaccination status.
Can we ask
Sure.
and what will happen, say, if with the health workforce and teachers' workforces, if there are outbreaks, will they have to quarantine as well? Or?
As I say, we'll take the health advice on that. At this stage, it's the public health units and the contact tracing team that decide who is a close contact and a casual contact. Every situation is looked at based on the own merits of what's happening in that particular situation. If the person is at the start of the virus, whether they're at the end of the virus, the likely risk, and then it is the public health unit that decides, is this a casual contact, is this a close contact, and whether they need to quarantine or not. Those decisions have always been made by the public health unit, and we'll take their advice on that.
The full geography modelling will be released today. Will the state government take that under advice when looking at our international borders?
Look, we'll always look at all the modelling, but we've outlaid our plan, and as we've said on a number of occasions, our plan is prepared on the basis of the best advice and what is safe and what is responsible for opening up this state. We are in a very different situation to Victoria and New South Wales that had broad outbreaks right across their communities. They're not risking bringing the virus in. Their virus is already there. It's throughout their communities. So the risk is very different in New South Wales and Victoria by letting international arrivals in without quarantining, because they've already got broad spread of this virus. Queensland, we allow international people to come in without quarantining. The risk is far greater in having transmission happening very quickly. We want to do this in a measured way. We know the virus is going to come in. Let's do it in a sensible, safe and measured way, which is in the best interest of business as well as keeping people safe.
Can I just ask Dr. Aiken,
Yes.
just on masks, the Premier sort of hinted yesterday that there might be some change coming on masks. So can I ask you your view on mask wearing into the near future? And then secondly, on masks as well, Cairns, which has exposure sites and has outbreaks but doesn't have masks, will they be transitioning to masks potentially, or are we sort of at the end of that now?
I'll take the second question first.
Sure.
It's okay, and you might need to remind me of the order. But for Cairns, there's been no further cases in Cairns, and at this stage there's no plans to introduce mask wearing into the Cairns community. We would just encourage people, if they do have symptoms though, to get tested, because if there are cases and community transmission, obviously that will change. The first question about mask wearing, and look, what we know is that masks are very effective at reducing transmission. At the moment, we're in a fortunate position that we don't have widespread community transmission, and we're or none. Yes, exactly. That's really good. But as our case numbers go up, and they inevitably will as we reach 80% double vaccinated and we start to have people coming into the Queensland community, masks are going to play a very, very important role in helping to reduce community transmission. At the moment, while we have none, that's something we're looking at the moment, and it may be an opportunity to relax some of those restrictions and mask wearing. That's a conversation we have to have, but it may be a short reprieve as well if we do get, and we will get, community cases coming back in.
But given that, you know, an outbreak is inevitable, in your view, I mean, will we ever sort of see the end of masks, or is that a post-90% discussion, or is your view as an expert that they will say indefinitely?
Look, I think there'll be an evolution in mask wearing, and we'll go through peaks and troughs as individuals choose to wear masks more than we advise, and that's a personal choice. But I think for the moment we are going to come into a phase currently where the risk is low, and we will come into a phase, as I said, once we get to 80%, where the risk of community transmission is high, and we'll probably see more mask wearing.
Just on the health worker vaccine mandate, it's now been a week since that deadline. Do you know how many show cause notices have been issued, and if they'll still continue to be on full pay, or if that ends?
I can't answer the number, but what I do know is that there's an increasing number of Queensland Health employees who are taking up the offer of vaccination, and the number who are out of the workforce at the moment continues to decrease, and that's a really positive thing. And I just ask all Queensland Health employees, and actually all health workers across Queensland, if you haven't been vaccinated yet, please get vaccinated. A key tenet of healthcare is first do no harm, and getting vaccinated and stopping yourself being the person who spreads COVID to patients in our hospitals and healthcare centres is absolutely vital.
And has Queensland Health seen any impacts from this, from the unvaccinated staff not being able to help? Or?
Look, there are always minor staffing challenges across all our hospitals and health services, whether that's because of floods, whether it's because of cyclones, whether it's because of local illness or industrial action. But we work through that, and there's been no significant impact on Queenslanders' access to healthcare at this stage.
Do you see any future for rapid antigen testing in the state once we move forward to 80-90%?
I don't think it's about 80-90% vaccination. Rapid antigen tests have been shown to be useful in other states when there's a high community caseload, and when we have no cases and no community transmission, as mentioned earlier, the reliability of rapid antigen tests is much less, and we currently recommend they aren't used, and we will continue to use PCR testing because we'd rather be accurate at this stage.
But in the future, though, you're talking about there will be cases in the future?
Look, I think there will be a role for rapid antigen testing in the future, but that will be as we move forward and we get more cases in the community. And to use the scientific language, it increases the positive predictive value of the test.
And so is that a conversation for the future, or what?
No, it's something we're talking about now, but it's just not the best option to use them at the moment, that's all. But we have to be prepared and have to plan, and we're having those discussions now.
In the Cairns case, have her close contacts been tested, and how concerned are you that she has potentially infected someone based on her viral results?
Look, at this stage, we have had no other positive cases in the Cairns and Cardwell region where she's been. We do know her movements, and those people have all been followed up, and there's been no positive test results in that group yet, and that's really, really good news. We also have to remember that this is about 13 days since she returned and came back into Queensland, so we've almost got that full incubation period, which is really promising. And as we get through that and increase our testing, and there are pop-ups in a number of regions, Cardwell today, there's a pop-up, that will get those test results come through, and hopefully there'll be no more positive cases, or no positive cases at all in the Cairns region, and we've got through this one again.
Do you expect to be able to outline the rules around how businesses will operate in terms of vaccinated customers or unvaccinated customers before December 17 or at December 17 or after? When will people be able to plan?
As the Minister said, there's meetings happening at the moment about just defining those rules and restrictions, and also not just restrictions but rewards for vaccinated individuals and vaccinated communities, because really, to go back to a question you asked about impact on staffing, it is all about relative risk, and we do take each case on its merits, and public health units look at that. And one of the key things that determines risk is how many of the staff are vaccinated, how many of the surrounding community is vaccinated. So I just ask all businesses, the best thing you can do to protect your business in those circumstances is to make sure your staff are vaccinated.
Will there be like a, what it means, what a close contact means or something like that? I mean, what do you consider that now in this world and then in the future when there are more people vaccinated?
That's something that's being looked at national level, and certainly the definition of close contact changed as Delta emerged, because we know it's a much smaller period of exposure that can lead to infection. And we'll continue to work through that, and those discussions are happening at the moment, because we'll also have a more vaccinated community, and that's hopefully the biggest change to how we approach close contacts.
And we saw restrictions introduced with aged care hospitals like begun to Whitby. Could we see vaccinated people able to visit aged care homes in the future in terms of these outbreaks?
Look, that's one of the things we're looking at, but we also need to remember that aged care facilities are our most vulnerable people, and we've seen episodes in other states where vaccinated staff members have led to cases in nursing homes, and vaccinated vulnerable members of those communities have ended up dying. So we do need to take it on its merit and each case at a time.
Okay, thank you.
Thank you.